Coronary heart disease, also known as coronary artery disease, is a disease characterized by inflammation and buildup of fatty deposits along the innermost layer of the coronary arteries. The fatty deposits may develop in childhood and continue to thicken and enlarge throughout the lifespan. So this thickening is called atherosclerosis, and it narrows the arteries and can decrease or block the flow of blood to the heart. Let's first talk about the coronary arteries. Coronary arteries supply blood to the heart muscle. So like all the other tissues in the body, the heart muscle needs oxygen-rich blood to function, and oxygen-depleted blood must be carried away. The coronary arteries run along the outside of the heart and have small branches that supply blood to the heart muscle. So the two main coronary arteries are the left main and the right coronary arteries. The left main coronary arteries supply blood to the left side of the heart muscle. So the left main coronary artery divides into branches, which are the left anterior descending artery, which branches off the left coronary artery and supplies blood to the front of the left side of the heart, while the circumflex artery branches off the left coronary artery and enriches the heart muscle. So this artery supplies blood to the lateral side and back of the heart. But to the right coronary artery, so this supplies blood to the right ventricle, the right atria, the sinus atria, and the atrioventricular nodes, which regulate the heart rhythm. So the right coronary artery divides into smaller branches, including the right posterior descending artery and the acute marginal artery. Additional smaller branches of the coronary artery include the obtuse marginal and the septal perforator. So why are coronary arteries important? So since the coronary arteries deliver blood to the heart muscle, any coronary artery disorder or disease can reduce the flow of oxygen and nutrients to the heart. This may lead to a possibility of a heart attack and possibly death. Atherosclerosis is the inflammation and buildup of plaque in the inner lining of the artery, causing it to narrow or become blocked. So it's the most common cause of heart disease. So what are the risk factors of coronary artery disease? Number one, smoking. So this narrows the arteries, thereby increasing the blood pressure and reducing oxygen supply. Number two, high blood pressure. So this damages the arteries and also increases heart strain. Number three, physical inactivity. So this causes obesity. Number four, high saturated diet. So this raises cholesterol, causing artery plaque buildup. Number five, diabetes. So this damages the blood vessels, which increases the cholesterol, thus raising the blood pressure. Number six, a family history of coronary heart disease increases the risk due to genetics and shared lifestyle habits. Controlling risk factors is the key to preventing illnesses and death from coronary artery disease. Symptoms of coronary artery disease. The symptoms of coronary artery disease will depend on the severity of the disease. Some people with coronary artery disease have no symptoms. Some have episodes of mild chest pain or angina, and some have more severe chest pain. So if little oxygenated blood reaches the heart, a person will experience chest pain called angina. When the blood supply is completely cut off, the result is heart attack and the heart muscle begins to die. Some people may have heart attack and never recognize the symptoms, so this is called silent heart attack. So other symptoms of coronary artery disease include: number one, heaviness, tightness, pressure or pain in the chest behind the breastbone. Number two, pain spreading to the arms, shoulders, jaw, neck or back. Number three, shortness of breath. Number four, weakness and fatigue. So today we're going to talk about the diagnosis of coronary artery disease. In addition to a complete medical history, tests and physical exams for coronary artery disease may include the following. Number one, electrocardiogram. Yes, the ECG. So this test records the electrical activity of the heart, shows the abnormal rhythms, and also detects damage in the heart muscle. Number two, the stress test, also known as the treadmill. So this is a test given when you walk on a treadmill to monitor the heart during exercise. So breathing and blood pressure rates are also monitored. A stress test may be used to detect the coronary artery disease or determine the safe levels of exercise after a heart attack or heart surgery. So this can also be done while resting using special medicines that can synthetically place stress on the heart. Number three, cardiac catheterization. So in this procedure, a wire is passed in the coronary arteries of the heart and x-rays are taken after a contrast agent is injected into an artery. It is done to locate the narrowing, blockages, and other problems. Number four, nuclear scanning. So a radioactive material is injected into a vein and then is observed using a camera as it is taken up by the heart muscle. This indicates the healthy and damaged areas of the heart. Today we're going to talk about the treatment of coronary artery disease. Number one, medicines can be used in the treatment of coronary artery disease. These medicines may include: number one, antiplatelets. So this decreases the blood clotting. An example of this is aspirin. Number two, antihypertensive. So this lower the blood pressure. So several different groups of medicines work in different ways to lower the blood pressure. Number 3, antihyperlipidemic. So these lower lipids in the blood, particularly low density lipid cholesterol. So statins are a group of cholesterol lowering medicines. Number 4, antihypertensive. So this lower blood pressure. So several different groups of medicines work in different ways to lower the blood pressure. Two among our treatment method is coronary angioplasty. So in this procedure, a balloon is used to create a bigger opening in the vessel to increase blood flow. So this can also be done in other blood vessels elsewhere in the body. So let's also talk about percutaneous coronary intervention, the PCI. So this refers to the angioplasty in the coronary arteries to permit more blood flow into the heart. So PCI is also called percutaneous transluminal coronary angioplasty, the PTCA. So there are several types of PCI procedures which include balloon angioplasty. So here a small balloon is inflated inside the blocked artery to open the blocked area. We can also talk about coronary artery stent. So in this procedure, tiny mesh oil is expanded inside the blocked artery to open the blocked area and is left in place to keep the artery open. Let's also talk about atherectomy. So in this procedure, blocked area inside the artery is cut away by a tiny device on the end of a catheter. Lastly, laser angioplasty. So here a laser is used to vaporize the blocked area in the artery. Under our treatment, you can also talk about coronary artery bypass. So this is also referred to as bypass surgery. So this surgery is often done in people who have chest pain and coronary artery disease. So during the surgery, a bypass is created by grafting a piece of a vein above and below the blocked area of a coronary artery. So this enables the blood to flow around the blockage. So veins are usually taken from the leg, but arteries from the chest or arm may also be used to create a bypass graft. Sometimes multiple bypass may be needed to fully restore blood flow to all regions of the heart. Thank you very much. I mean, would you please like my video, share it, and also follow me up.